Welcome. My name is Scott Barrett. I'm the Lenfest Earth Institute Professor of Natural Resource Economics at Columbia University with appointments in the School of International and Public Affairs, SIPA, and the Earth Institute. And I'm delighted to welcome you to the first of a series of webinars on COVID-19 policymaking in the throes of a global crisis. My co-host for this seminar is Jeffrey Sachs, who is also going to be our speaker today. So Jeff, please, over to you.
Thanks, Scott. And thanks to colleagues and students. You know, this is really brainstorming this semester. There's so much knowledge, talent, and effort underway in our community to address the pandemic, and it's not easy. This is really a very deep crisis, and it's we're not past the heart of this crisis by any means. So we really have to be innovative and thinking as best we can in order to figure out what to do. I think it's a very notable crisis in a lot of ways. Obviously, this is a very dangerous virus. That's the first key point. Obviously, there was little, if any, natural immunity in the global population. So in this sense, we don't really know, but there's a very high susceptibility to infection, and the virus obviously has spread to all parts of the world with extraordinary speed. It is also a very unusual virus in a number of ways that Jeff Shaman has helped to illuminate the amount of asymptomatic or pre-symptomatic or low symptom transmission, which makes it much harder to control than SARS was, where infectivity came after ample symptoms, indeed with the delay, it seems. And this one transmits quite effectively without that. I would say that there are two other notable aspects of this pandemic. It's our first truly digital age pandemic. So not only are we responding to it with digital tools, but it has meant a particular mode of change or reaction to the pandemic that's unprecedented. It's changed our lives in an obvious way of moving immediately online. It has created new divisions socially, politically, economically, and financially in society along the digital divide in ways that I think we would not have understood. It has accelerated the digitalization of work probably by 10 years in the first 6 months of the pandemic compared to the trends that were underway, or maybe even faster. And another aspect of this pandemic, which has been true probably in many pandemics of the past, but not quite in the same way. This pandemic has already been extraordinarily politicized, politicized in terms of domestic responses. For example, the politicization of face masks, that face masks became a left-right issue. I don't recall this kind of thing before, although of course we recall in every past pandemic lots of politics. HIV/AIDS pandemic was an extraordinarily politicized pandemic, but in a different way. Another aspect of the politics which is profoundly worrying is the geopolitical politicization of the pandemic. We have a right-wing government in the United States. I think it veers on fascism, but it has taken this epidemic partly for tactical electoral reasons and partly for maybe belief or strategic reasons as an opportunity to engage in a verbal war with China, and God help us, something possibly worse. And so this is another aspect of what we're seeing. It's in that context, Scott, that we've launched a commission to, and it's one of many efforts, but with the Lancet and with an esteemed history of Lancet Commissions, which I'm honored and delighted to be part of now, to try to bring across a number of different domains expertise and rational analysis and response to the pandemic, to be at least one beacon of information and insight and analysis for the world community. So the Lancet has sponsored many commissions over the years on topics of high public health interest, whether it is on universal health coverage or the question of environmental health issues, or how to achieve particular objectives around the Millennium Development Goals and the Sustainable Development Goals. And Richard Horton and I discussed the idea of a multidisciplinary COVID-19 commission that could not only issue a report at the end of a process, but operate in real time to help provide information by engaging the global expert community in a way that was outside of the geopolitics and to the extent possible outside of the heated partisanship, to understand and present data and analytics. And the idea of the commission is to address the pandemic in a holistic manner. So 4 main thematic areas in my understanding of our mission and assignment. The first is suppressing the epidemic itself. And there, I think there are 2 major paths of suppression. One is the tools of public health that are especially around breaking transmission chains. So the so-called non-pharmaceutical interventions, or NPIs, face mask wearing, physical distancing, closing large events, contact tracing, and so forth, the tools of public health. And the second is the tools of pharmaceutical interventions, diagnostics, therapeutics, and vaccines. So 2 modes of suppression. Almost surely they're going to have to work in a complementary way. We mainly have the first set of tools right now, NPIs. We're hoping we'll have a second set of tools of more effective, more effective therapeutics and vaccines in the near future. If we do get a vaccine, it will certainly be the fastest rate of vaccine development and implementation in history, as far as I know. And it's one of our main topics, how, not which vaccine, but the governance issues around that. The second big theme of the commission is the humanitarian crises that are attendant upon this pandemic. And my feeling is that we are experiencing a profound humanitarian crisis now that we haven't really been able to identify or measure in real time to this point. My guess is that there's a very pervasive hunger crisis underway, whether it's absolute calories or a deep malnourishment or undernourishment of proper diets. I would guess that this has worsened dramatically in recent months. We have lots of studies which suggest that it will worsen. We don't have much data other than anecdotal data that it has worsened. But the logic of the situation is certainly that there must be a very serious crisis underway. Why? Because we know that poor countries and poor people have suffered catastrophic losses of income relative to their margins of subsistence. Remittance income has plummeted, tourist income has disappeared, economies of low-income countries have been seriously dislocated. Lockdowns took place in very poor places as well as in higher income countries. And so the cumulative effect of all of these shocks is very serious. And when we're talking about the poorest people, by definition, almost, we're talking about people without buffers, without wealth buffers, and so on. This has been also, even within the United States, an extraordinarily weird epidemic from an income and wealth distributional point of view. The stock market has gone up significantly during this pandemic, which is not the case, of course, of a normal economic contraction. As I understand it, I haven't really reviewed the history. During the flu pandemic 100 years ago, the stock market didn't suffer very much, but it didn't soar. But here it soared in certain areas. And the digital side of the economy has led to wealth increases that would have been unimaginable under any circumstances, but came in the midst of mass unemployment and shutdowns. So Jeffrey Bezos personally is up around $90 billion since the start of the year. I think if you add Elon Musk, Bezos, and Zuckerberg, it's last time I checked was around 190 billion total for the three people. The top four Americans in wealth, adding Bill Gates in, had $524 billion of net worth when I checked last week. So four people. It's extraordinary, but at the same time, we have unprecedented unemployment for low-income people. And translate that to the very poorest countries, you have a very deep humanitarian crisis underway. The third area is the financial fallout over the longer term. So I would say that we're building up major financial crises all over the world, which is usually the legacy of deep economic contractions. Governments, of course, have taken on soaring debts. The US deficit out-of-date estimate by CBO was 1.7 trillion, increased 3.7 trillion total deficit, something on the order of about 16 or 17% of GDP for 2020. That's a lot. Public debt as a share of national income in the United States has soared well past 100%. I think the most recent CBO estimate is something like 108% by the end of the year. We're going to reach debt levels that we haven't had since the end of World War II in circumstances that will be much harder to deal with in many ways, though with the one unusual feature of near zero interest rates right now, at least in the short term, meaning that debt service flows for the US are actually going down even as the stock of debt relative to GDP goes up. But this is to say that companies, households, and governments will have a long shadow of massive debt and budget dislocations from this. So it's often the case, like World War I was, that you get a calamitous shock and then it's followed by a long-term financial crisis. And I think that this is quite possible in the current circumstances, though quite complex and with some contradictory features in terms of making specific projections. The main saving grace right now is the very low interest rates and very ample liquidity from the major central banks. But still, the budget deficit situation is very large. And we face it in New York as just a microcosm. This is the city with the most billionaires in the whole world, 111 billionaires. It's also laying off teachers, police, sanitation workers, with an $8 billion deficit, and the business community demanding cuts in the city. And I can tell you on an anecdotal level, as a grandfather with children in New York public schools, that the teachers are being cut, budgets are being slashed in this very rich city in the world, and imagine what it's like around the world. So this financial legacy, I want to try to address up front rather than to wait for dominoes later of disarray. And then the fourth issue, which is related, is the macroeconomic and institutional recovery from the crisis as well, especially the Build Back Better question. And there are really two dimensions of that mandate of the Commission. One is the public health system globally. Here we have the United States announcing its withdrawal from WHO as part of the geopolitics. Absolutely just ghastly and extraordinary, but reflective of our dangerous hyper-nationalized situation. And we failed utterly in surveillance and preparedness. It's ironic to look back at the lists, of which there were many, I think, including a Johns Hopkins preparedness index of last year, global health preparedness index, where United States ranked #1, and almost every high mortality country in the current epidemic ranked in the top of the list, all the Western European countries. Certainly, we didn't understand what preparedness really is. And we've seen the death of CDC, or the near death of CDC in this pandemic, hyper-politicized, failed at a technical level, shockingly unprepared, dismantled along the way. So it's weird, but this is part of a more general syndrome, because it's not unlike the climate change agenda that Scott and I have been grappling with for 20 years. We don't have the mechanisms of cooperation working, and we're absolutely failing on that. So that's one of the questions. And the other question is the more macroeconomic question: how will the world economy recover from a shock like this? One thought, which is feasible, though I believe neither attractive nor that much likely, is a basically monetary-led recovery, something like post-2008, where there might have been some fiscal stimulus, but it was basically easy credit, and then working past what had been a financial panic at the end of 2008 and getting a consumption-led recovery underway. That's one vision of the macroeconomic recovery from the pandemic. I would like very much this time, and I wanted it last time, but wasn't very well heard or agreed with, to try to have an investment-led recovery, where the idea was we would use the extra resource space to build sustainable infrastructure, make the energy transformation, make a kind of green recovery. And this time there's a lot of interest, certainly in Europe, a very explicit interest that the European recovery should be based on a Green Deal scenario. And I think if Biden wins the election, we have a real prospect of a US green recovery scenario where Vice President Biden's talked about putting in $2 trillion of spending. I'm not sure exactly where and how, but during the first 4 years on a green recovery. So one of our work projects is that issue. So the mandate is through the end of 2021, and we've set up task forces across all of these topics, and I would invite our colleagues that are on the line that would be interested in being part of one or the other of these task forces to let Yanis or me know. These are really attempting to be global groups of experts on key challenges of facing the pandemic. And a lot of the detailed work will go into those task forces. We'll issue the final report early in 2022, and then statements, policy briefs, interim reports along the way is the idea, so that it's an active body along the way, and then a final report in the Lancet in early 2022. Who knows what will happen after that, but that's the time dimension. So in that context, we just issued the first statement of the commission. It's obviously a work of synthesis, not of original research, by people who are engaged in those 4 topics. So some are public health specialists, a couple are in vaccine development, some are working on the humanitarian crises, and some are engaged in international finance, and with the strong participation of the UN agencies, because we go into this ideologically supporting the UN system as the right response. So it's upfront, this is a pro-UN commission, and a belief that we need to make the UN Charter and the UN multilateral system effective. Maybe we'll recommend reforms, but the idea is to bolster the system, not to hinder or undermine it, or even to treat it as a hypothesis. It's treated as an axiom, I would say, that we want to make the system work. So yesterday was the opening of the UN General Assembly's 75th session. And on the occasion of the opening, we issued the statement, which we've sent around yesterday. And I will close just by noting some of the highlight points of the statement as it stands right now. First is to note on the origins of COVID-19. There is a question about the origins that's a quite important question to understand how this disease emerged, so that we are better prepared, not only actually partly to understand what to do now, and partly to be able to prepare against the next zoonotic events. By far the dominant scientific narrative, and Ian Lipkin is a key part of that, and the global peer-reviewed published community is all online as far as I know, is that this is a natural occurring zoonotic event of a virus in horseshoe bats that probably has had the capacity to invade the human population with this particular receptor device for invading our cells, probably for decades, actually, is what the most recent published analysis suggests, that the evolution of this virus probably dates some decades, and that this is a naturally occurring zoonotic event. There is another narrative that is pushed very hard by the US government, that this was a laboratory release and possibly a laboratory concoction in the Wuhan Institute of Virology, and that this is the a Chinese-made disease that was covered up in its release and that has infected the world. It's a remarkable claim that would be almost a casus belli if true, and it's stated almost as a casus belli. And in that sense, it's more than a casual point. In my view, it's an extremely dangerous point, but it's also an important point to settle. So we note in the opening of the statement that the overwhelming evidence as it exists right now is that this is a naturally occurring zoonosis, but we will have a working group that will work on this issue. And the leader of this working group, who will get a world-class community of virologists and ecologists, is Peter Daszak of EcoHealth Alliance, who's the world expert on zoonotic transmissions from bats to humans. It will be very important, this work. I should note in passing, this has been the media interest of the report more than anything else, I would say, in the UK, because of this politicization of the virus. The true interest of the report, in my view, is even more the next point of the report, which is that it is possible to suppress this pandemic through non-pharmaceutical interventions. And this is a claim that I think we should have discussion of. It's not universally held, I would say, among esteemed colleagues and public health practitioners. Probably, if I don't want to be unfair to him and misquote him, but I would say that Mark Lipsitch, for example, at Harvard, is a skeptic of this claim. So our claim is that you can actually reduce our effective reproduction rate to below 1. That is, you can break the transmission chain through face masks, physical distancing, test and tracing, closure of large events, workplace safety, and so forth. No one step is sufficient to reduce R0 to below 1. We're probably trying to move from something like 2.4 as an R0, or between 2 and 3, to something less than 1. And so I think it's a suite of non-pharmaceutical interventions. For me, the most important single fact of this pandemic is that a group of countries has kept the transmission rate extremely low. And those are the Asia-Pacific countries. And I think that this is the single most notable public health aspect of the pandemic, that we have 2 orders of magnitude difference of measured cases and measured deaths per million population. China, Taiwan, Korea, Japan, Hong Kong, Vietnam, Australia, New Zealand, Cambodia, Laos PDR, all are in single digits per million new cases per day, constantly, and deaths that are near 0, according to reports. Now, either the data are all wrong and there's massive escape of cases from measurement, or something different is happening. And I think the overwhelming evidence is something different is happening. It's a question of why exactly. My own view of this is that public preparedness because of SARS, H1N1, Nipah virus, MERS, really sensitized the region. I think the neighbors of China don't trust China very much. So as soon as the news got out that this was bad, the reaction was extremely strong. But China's reaction was extremely strong and competent also. If we knew only the epidemiological facts of the high degree of pre-symptomatic and asymptomatic transmission, I think it would be from an ex-ante point of view, plausible to say you can't really control this. It's going to run its course unless we develop a vaccine. But the empirical evidence to me suggests that the cluster of NPIs is actually enough to control the pandemic. So that's a stated conclusion of the statement yesterday. Go for NPIs. That's not the same as lockdowns. That is targeted public health measures, stop super spreader events, wear face masks, quarantine when self-isolation is not adequate. Do not infect your family members, your housemates, and all the rest. Have ways for quarantine, and that this can be done not just in, Chinese massive lockdown. It can be done in New Zealand society, which looks a lot more like the United States, or in Australia, and so forth. Just to mention, I have a bet with Mark Lipsitch that as of next spring, I say it will be under control in these countries. He says it will be in general transmission, not necessarily explosive. We've tried to define it quantitatively, but there is a view that all NPIs do is actually slow or prevent the inevitable, so that they flatten the curve, but they don't really break transmission. But this report says that it's breaking transmission. Very quickly, to go to the other major conclusions of the report, we call for emergency financing on humanitarian crises. The IMF has had 80 countries receive some level of emergency financing, with $87 billion of emergency aid. Most of this is 10-year zero interest loans with something like 5-year grace period. So it's pretty generous. My feeling to any finance minister, any mayor, any governor is spend now to contain the pandemic. Do not economize on public health at all. And do not economize on fighting hunger or other humanitarian emergencies. So we're calling for the IMF to open the spigots more widely and to have more surveillance on real-time surveillance on hunger and other crises, so that we can say not 6 months later, but now, babies are dying, people are suffering, we need to move money into the following 16 countries and to have the mechanisms to procure the supplies and so forth. We have a number of statements about overcoming the various inequalities of the pandemic, which are true in our country as well as in the poor countries. And then when it comes to the vaccines, we make the controversial statement that vaccines should be developed scientifically and properly and not by Donald Trump. So we call for proper phase 3 clinical trials and the non-politicization of the vaccine. I think the cat is out of the bag on this with Putin's move to put in place the Russian vaccine before phase 3 trials were done. China may do the same. Trump, I think it's pretty clear, will announce sometime in the coming month that a vaccine is ready, no matter what anybody says or what is done on trials, because that is Donald Trump. And this is likely to happen within the next few weeks because of the upcoming elections. And then I think the final point that I would say right now is that our next report will be January 2021. Back to you.
Jeff, thank you so much. Boy, it just makes me long for the days when we could interact, and just really fascinating. And there's a huge agenda there. We've only got 5 minutes left, at least for the scheduled program. So I'll ask you one.
Oh, I'm sorry. I thought it
That's
was still
okay.
I thought it was still 2:30. I apologize. I didn't mean to filibuster so much.
Well, we're going to hold the Zoom session till 2:30, but I think that it's best for people are free basically between 1 and 2, so that's the best time to concentrate. So let me, Giannis, with your permission, I just want to ask one question, and hopefully Jeff can be. I'm going to ask a ridiculous question, so he can't be too quick, but hopefully Giannis will be time for you to jump in. There's so much to say. I mean, it's not just that we've got this terrible crisis, it's also that this is being placed on top of a world that's already in great flux, and I think teetering on a kind of danger. So, you could say that that's true domestically, trust in institutions, trust in science, belief in science, belief that institutions, especially public institutions, can actually achieve things. It's really quite extraordinary. But one of the concerns I have is one that you underscored as well, which is the global picture. And internationally, what's so striking, so SARS, a previous coronavirus outbreak, that was a very scary situation, particularly early on, very scary. And the world reacted in a very different way. There was much more togetherness, to use that term. Yep. Now the overwhelming impression you have is every man for himself, or every country for itself. It's all nationalistic, even if the politics are not purely nationalistic. The response has been largely nationalistic. And okay, your COVID commission is pro-UN, but after SARS, the world learned from the lesson and revised the international health regulations to correct for a problem that they observed, which was not only did China not report SARS in a timely manner, but it had no legal obligation to do so. Now, this time around, because that revision was made, actually China, for all the criticism it's received, it responded much faster than it did with SARS. Could be faster? Probably, yeah, sure. But the main point I'm trying to make is that when your institutions aren't functioning the way you want them to, the natural thing to do is to make them better. And that was our attitude at the time of SARS, and that's what we achieved. But the response now is, well, we'll just withdraw from the World Health Organization. It's not just that, though, because without US leadership, the whole fabric of the international systems, the investment that's made in finding collective solutions to a common problem, that seems to be, it's disappearing. And if it's not something that's promoted actively, we can lose it. And then we're entering in a very dangerous world. So I mentioned, just one last thing I'll say, I mentioned that this is probably the biggest crisis with direct impacts on humans around the world since World War II. We left World War II learning the lessons from that and trying to change the whole international system, creating institutions like the UN. But now it seems with this crisis, if anything, we're pointed in a different direction, which is which is a dangerous direction. I'm sort of curious if you have thoughts about that. It's kind of the bigger picture of this, because so much depends on that whole system functioning.
Absolutely. Yeah, and you've written so eloquently on all of these themes for so long. It's extremely pertinent, what you said. I think, as I was growing up in trying to understand these things and studying in the 1970s, we learned the two cases, post-World War I and post-World War II. So they were both the global crises, but after World War I, we didn't learn the lesson of cooperation properly, and we ended up with a Second World War. And so it was in many ways the failures of the Treaty of Versailles and then the failures to handle the Great Depression that led to the rise of Hitler and led to World War II. It's quite clear that World War II was fought with an extremely conscious design to not have the outcome of World War I repeated. And I think Franklin Roosevelt was our greatest president, and he wanted to build a kind of world afterwards that really would make an effective global organization and an effective response to the finances. So the Bretton Woods institutions and the UN Charter are the brainchild of a vision that responded to the failures of World War I, and very much a US made. There were always two elements of it. By the way, of course, there was, we'll make a multilateral system, but it will be a US multilateral system. So it was both, it had its national elements and it had its multilateral idealism, both. It's a complicated topic, but on the whole, as I said, I think Franklin Roosevelt's the greatest president we ever had. When I studied this topic, and of the difference of responses, the book that we read in 1973 was The World in Depression by Charles Kindleberger, which is a wonderful history of the onset of the Depression and its dynamics. But Kindleberger had a basic hypothesis that the reason that the Depression was so deep was that there was no leader at the time. And it became codified as hegemonic leader theory, that you couldn't get a response after World War I. Partly the United States had, of course, not joined the League of Nations, but that Britain was so weakened by the war that there was no longer a Pax Britannica, and there was no longer British financial leadership, and the United States did not step forward to lead in the 1930s, and so we had a prolonged depression and an onset of a new war. Putting all of that in our current context, I would say first, we are in a Kindleberger moment. There's no global leader. I don't think we're in an inter-hegemonic period like Kindleberger envisioned, where the baton was passed from the UK to the US, and now it will be passed from the US to China. For many reasons, I don't believe that scenario. I don't wish it, but I also don't think China, I don't think we're in a world where there could be any hegemon under the current circumstances. So, but what has happened is the US leadership has waned and cannot be, even if we wanted it to, cannot be reestablished on the same basis as 1945 or 1973 or 1989. We're just a smaller part of the world, and we've got our own wounds to heal, and we're not in a position to lead the world, and nobody really wants us to lead the world, but they do want us to not be crazy and not destroy the world. So I think our fate is either the worst of a bellum omnis contra omnis, a war of all against all in a Hobbesian vision, or global cooperation under a Kantian imperative manifest in the UN Charter. It's one of the two. And Trump, at a level of psychology, I would say psychopathy, but as a level of psychology and ideology, does not believe in cooperation. He believes in winning. So to him, the prisoner's dilemma is obvious. You always defect. Any sucker cooperates. And it's so self-evident to him that defection is the only equilibrium, that everything else seems just sheer folly to him. And he's run his whole life that way. So he can't imagine a world of cooperation. And in this sense, I think this is really the challenge. What is troubling is, you know, in a prisoner's dilemma world, the bad equilibrium is a true equilibrium, as you know very well. And we could end up in that sheer outcome of complete distrust and breakdown in a rational way with a disastrous outcome. And there's nothing that prevents that from happening. Rational, I mean, in the very narrow rational sense of the non-communication, non-cooperative outcome. And it scares the wits out of me. It's, to my mind, the single biggest danger that we face in the world is this seeming thirst for confrontation. And we have a Secretary of State who is an extremist every bit as much as Trump. Pompeo is absolutely a radical, and his speeches are, to my mind, horrifying. And they have a literal evangelicalism that is stunning. He does seem to believe in Armageddon. I don't want Armageddon. So I'm not too happy with the Secretary of State that apparently literally believes in the imminence of Armageddon. It just seems a bad starting point for working our way through this crisis.
I'll just, I don't know if Zoanosis wants to ask a question, but I'll just make a comment about what you said. I'm not sure if you know this or not, but you mentioned the Treaty of Versailles, which, as you said, basically laid the pathway to World War II. And of course, that was negotiated by, amongst others, Woodrow Wilson.
Of course.
In Paris. And in this book, The Great Influenza by John Barry, he puts together a case that Wilson, instead of having a stroke when he was in Paris, actually had influenza. Oh, and that he was impaired. His cognitive abilities were impaired, and that was noted by his staff. And he caved into the French to craft a deal that basically paved the way for World War II. So, you know, it's an amazing thing that a pandemic like we have now, it has all these effects that are, you know, so large scale you can't ignore them. But then there are these other things that happen, and so much is at play.
By the way, that makes perfect sense, because in Paris there was no evident stroke, but it's been treated historically as a transient ischemic episode. But a flu is a much, actually makes a lot of sense.
Yeah, actually, so Barry actually argues that instead of, but probably what happened was actually the flu made it more, made Wilson more vulnerable to a subsequent stroke, which came later, the major stroke that came later. But he did basically, he did, you know, they were camped out in Paris for a very long time, and he did a U-turn, and the pandemic was spreading, of course, through there. And that pandemic, I would also say, is very similar to the one we're in now, in that what was so critical about that influenza pandemic was that the virus spread before symptoms showed.
Wow.
So no one knew who was sick, and that's such a critical thing for the spread of diseases. So,
and by the way, one footnote for our students is that reversal by Wilson produced the greatest macroeconomics book probably in history, in my view, The Economic Consequences of the Peace by John Maynard Keynes in 1919, which said, this is crazy what we've just agreed to. This is going to lead to disaster. And Keynes essentially invents macroeconomics before your eyes in that text.
My friend, I was looking at my shelf, I have the first edition of that book because it was one of the most influential books of my career, because here you had, you know, an economist, you know, to some extent a bean counter, right? That's what's so fascinating about that assessment of the treaty.
Yep.
But he's able to take all of that and be able to make this prediction about the consequences of this for the future.
By the way, Scott, that book was decisive for my career.
Oh, it's so
In
interesting.
literally 2 sentences, changed my life in 1985 when I was advising the Bolivian government, and I helped them to negotiate a debt cancellation eventually. But Keynes's paragraph about it is not right to expect that this generation will pinch itself to deliver the reparations, basically, that's not how the world works. And that was, it was like Keynes talking personally. Jeff, go tell them you don't have to pay the debt because it can't work in this way. And it had an incredibly decisive effect on.
You know, it's so funny. For me, I'll just share this one last thing, Yannis. Sorry to, but he also was very.
It's clearly a conversation between two economists at this point. So whenever you're ready to let the public health speak,
it's also, he was also remarkable at understanding human nature. And he basically, he said, this had a big influence on my work too. He said, you basically, in these negotiations, you brought these individuals together, you know, Foch and Wilson and Lloyd George and so on. You brought them together, and the outcome you get is a product of those people.
Yeah.
So it wasn't that it was an inevitability to it. It was, and basically what he said is, we have the wrong team.
Right.
And that's one reason why I was drawn to do experimental work, because it really, a lot of this does come down to people. You mentioned FDR, it makes a difference.
Yeah.
It's not just about the institutions, it's also about the people. Yannis, my apologies. Let's get back to microbiology.
I wonder, well, you know, I see Jeff all the time, so I don't really have questions for him, but it's more like two quick additions that Lancet is also focusing on, two additional areas that are quite important. One that we have called safe work, safe travel, and safe schools. Obviously, now that, you know, schools are reopening in North America and in Europe, this is going to be quite interesting to see whether there are outbreaks, how these outbreaks are being handled, and how the Lancet Commission can give a clear recommendation on whether to keep the schools open or not. And then the second one is about mental health. And I don't think that Jeff has mentioned that. Quite important. Obviously, many of us, you know, at some point in April, I think that 90% of the world population was in a country that had some form of lockdown. So what are the mental health impacts of this denormalization of life? And also in the long term, you know, our ways of being with people, everything is now gone mostly online. You know, you shop online, you go to school online, you work online. Suicide ideation, I think, have seriously increased. And so what are the long-term impacts of the disease itself, but also the measures that are taken to fight the disease? So these are two additional sides that the Commission is going to work on.
Yeah,
I'm wondering
thanks,
whether we have
Yannis. I just wanted to mention the task force on the safe schools and workplaces being led by Professor Joe Allen at the Harvard School of Public Health, who's absolutely amazing. And I didn't even know his profession existed exactly until this pandemic, but he's a professor of exposure analysis to understand ventilation, subway systems, airplanes, how transmission takes place in built spaces. And it's incredible work. You know, he's been the one writing fantastically insightful op-eds about airplanes and their ventilation systems and their bathrooms and so forth. So he's the go-to guy on everything. But his theme, and he has a new book called The Safe Buildings, and not just about the pandemic, it was written before the pandemic, but the idea that we need to build our physical environments with an anticipation of infection risk and so forth. And it's a fantastic body of work that is really important right now.
I enjoyed it so much, Jeff, as I always do. A great talk over something that is clearly having profound effects on the entire global society right now. And for young people, especially our students, this is going to change your whole future. And so everything is in play. And it's really important that we do what we can to understand this and shape our future as much as possible. Andrew, is there anything else we should say at this point?
I don't think so. That was a great talk. Thank you, Jeff.
All right, brilliant. Thank you,
Fantastic,
Jeff.
everybody.
Sachs.
Good.
Great. I really enjoyed it. Thank you, Giannis. Thank you, Andrew. And
Thanks,
thank you,
Scott.
everyone,
Thanks,
for
Andrew.
joining. And we'll see you next week.
Next week.
Perfect. Great. Thanks a lot.